For this rehabilitation video, we will be focusing on how to improve anterior cruciate ligament health after a second grade strain. The goal of this video is to improve the range of motion, strength, and proprioception of the knee. Throughout the video, we will progress from easier exercises beginning from a sitting down position to a standing position with support, and finally without support. This progression will help the individual to gain confidence, range of motion, proprioception, and strength of the knee joint, which will help to prevent further injury and increase stability along with promoting health. Our first goal is to increase range of motion of the knee joint. The normal range of motion for the knee joint are as follows. Flexion at 135 degrees, extension from 0 to 15 degrees, internal rotation at 10 degrees, and external rotation at 10 degrees. Range of motion of an injured knee joint can be limited due to pain and inflammation of the joint capsule. Therefore, when an individual is injured with a second grade sprain of their anterior cruciate ligament, there may be limitations such as certain degree of laxity in the joint of around 5%. Muscle may show signs of guarding during the last 10 to 15% of full flexion and extension. The exercise that will help to increase range of motion is the heel slide and quad set. Start by sitting on a firm surface with your legs straight in front of you. Slowly slide the heel of the non-injured leg towards your buttocks by pulling your knee to your chest as you slide. Return to starting position slowly. When back in the starting position, press the back of your knee to the floor by tightening the muscles on the top of your thigh. Hold this position for 10 seconds. Then relax the muscle and return to starting position. Once completed, follow through the same steps on the injured side. When performing this exercise, the individual should strive to achieve 3 sets made up of 6 to 8 reps with a resting period of 1 to 3 minutes between each set for proper recovery. This exercise should be performed every second day and should be completed 3 to 4 times a week. Our second goal is to increase proprioception of the knee. An individual who has a second-degree sprain of their anterior cruciate ligament may feel instability in the knee joint. This may be described as a feeling of giving away of the knee. Therefore, the exercise that will be encouraged will help the individual increase stability of the knee to reduce this feeling in the future. The exercise that will help to increase proprioception is the balance and reach exercise. Begin by standing upright next to a chair, which will provide you with balance if needed. Stand on the foot farthest from the chair. In this case, start with the non-injured foot first on the ground, which will be used to bear their weight. Using the hand not touching the chair, reach in front of you, allowing your knee to bend. To increase difficulty, try and lean further forward during the exercise, or adding a diagonal stretch across the body with the outstretched arm. When performing this exercise, the individual should strive to achieve 3 sets comprised of 6 to 8 reps, with a rest period of 1 to 3 minutes between each set for proper recovery. The exercise should be performed every second day and should be completed 3 to 4 times a week. Our third goal is to increase and maintain strength of the knee. During resisted tests, individuals who have a grade 2 strain will show weak amounts of force production during a resisted test. As well, they may not be able to fully strengthen or bend the knee. The strengthening exercise that we will be focusing on is the wall squat. First, begin by standing with your back, shoulders, and head against the wall and look straight forward. Keep your shoulders relaxed and your feet 2 feet away from the wall and a shoulder width apart. Keep your head against the wall and slowly squat to a 45-degree angle. Your thighs will not yet be parallel to the floor. Hold this position for 10 seconds and then slowly slide back up the wall. To increase difficulty, you can complete the same movement except you will place a ball behind your back, keeping your head against the wall. Slowly squat to a 45-degree angle like previously shown. When performing this exercise, the individual should strive to achieve 3 sets comprised of 6 to 8 reps per set, with a rest period of 1 to 3 minutes between each set for proper recovery. The exercise should be performed every second day and should be completed 3 to 4 times a week. There are many factors for an athlete to consider before returning to their sport. Before considering return to sport, the athlete should have a restored range of motion to the average range of their knee. There should be an even strength between legs and no inflammation. If the individual can sprint ahead without pain, do 45 and 90-degree cuts, are able to jump on both legs, and pass the interior jaw test, this person may be eligible to return back to sport. But they should consult their doctor first and take his or her medical advice. If there is any persistent pain, please consult with a doctor to discuss possible reconstructive surgery or other methods of treatment.